disorder, you're not an alcoholic. Opioid use disorder, you're not an opioid addict. Nevertheless, it is a chronic relapsing condition, and you have an unhealthy relationship with whatever it is you're addicted to, whether it's drugs, alcohol, or a behavior. We have gambling addiction, we have sex addicts, there's all sorts of addictions. A big one I'm going to talk about a little more that a lot of people are struggling with, the screen addiction. But the statistics, you're reading this in the papers, for opioid addiction, it's horrible. On the right there, you'll see, so 45 million Americans are addicts or alcoholics. Half of us are in recovery. That's a huge segment of the population. Alcohol kills over almost 3 million people every year globally. But opioids are just taking over in the overdoses and the deaths that we're seeing. You're reading the papers. 2016, 63,000 overdoses. 2017, 72,000. This is more than the entire Vietnam War. This is more than all motor vehicle accidents, homicides and suicides combined. This is a huge, huge problem. So I don't know how many of you are familiar with the term harm reduction. This is your methadone clinic model. When I went and got board certified in addiction medicine, this was being taught as the way to go. Now, it goes like this. You come to my methadone clinic. I'm going to start you off at a moderately high dose of methadone. So pretty soon we're going to increase your dose to the point where all your opioid receptors are flooded. And if you go out and use, it'd be pointless. Methadone is a very long-acting drug. It lasts a half-life of a day and a half, sometimes longer. And so as long as you take your dose, you go out and use heroin, it's pointless. And people learn that real quick. And because of that, there's a lot less needles being used, a lot less HIV being transmitted, Hep C, and we are reducing harm. And it's true. You will have less overdoses, less transmission of sexually transmitted diseases. I'm also a pediatrician, and I was having late teens, kids who get addicted to pills and then maybe heroin, showing up at methadone clinics at the age of 18, 19, 20, and being put on high-dose methadone for life. It's horrible. You are addicted forever. It shuts off your pituitary, which shuts down your thyroid, shuts down your testes if you're a male, ovaries if you're a female. You are in bad shape long term. It's not a good idea. I wanted to show you this graph because buprenorphine, that's the green line, bup. This is the tool I use in my clinic. It's a very great tool for doing something like harm reduction, but in the younger age group that I work with, we wean these kids down until we get them free. And so notice that methadone has been around since the 1990s, but even from 2000 on, the number of methadone patients went up a little bit, went down a little bit, but it didn't skyrocket like the buprenorphine patients who started in 2002 and now way up there. And look at the overdoses going down corresponding to the rise of use of buprenorphine. That drug is saving lives big time. It is a partial agonist, meaning it has an opioid effect, and it's a partial antagonist, meaning it blocks the opioid receptors. So think of it just as 50-50. It's not going to get you high if you're an opioid user. It's going to give you enough opioid effect that you don't withdraw, but it blocks those receptors so you can't go out and get high. So then again, just like the methadone, it helps these folks not seek drugs because there's no point. They just take their buprenorphine, and it's been an amazing tool in my clinic. So I'm going to just talk you through what I do in my clinic, because I think it's worth knowing how this works. A young adult comes in, usually with their loved one, and we have already spoken to them and made sure they come in withdrawal. Now, if you're addicted to opiates, the last thing you want to do is be in withdrawal. And it is one of the hardest things to do cold turkey. That's why people don't. Once you're physically dependent on opiates, it is almost impossible to stop on your own because the shakes, the chills, the body aches, the twitches, the nausea, vomiting, it's horrendous. You know, people who've gone through an opiate withdrawal might know how hard that is. So if you come in partially in withdrawal, We're going to give you a test dose of buprenorphine once we make sure you're actually in withdrawal, because if you give a buprenorphine too soon to somebody who's not really in withdrawal, you precipitate withdrawal, and they puke right in front of you, and it's horrible. It's only happened to me once. Somebody fooled me, and I was like, okay, never again. But I tell the family members, and this is something, some of you may have family members who are struggling with addictions. Relapse is expected. This is a chronic relapsing disease, and who gets it first time? Very few people. And if you have this sense that they're in my office, now you're going to be good forever, and they relapse, then they feel a failure, self-loathing, they don't come back, and I've lost that patient. So I tell them, relapse is expected but not required. Please come back as fast as you can if you relapse. And that's helped us have really good outcomes. So this is an illustration in my book. There's 3 frogs sitting on a log. Some of you may have heard this one. And one of the frogs decides to jump off. How many frogs are left on the log? 3. Making a decision without acting results in nothing. This is our problem with addicts. Yeah, I'm going to quit tomorrow, or I'm done with this. I mean, I did that 1,000 times before I finally quit. I'd be disgusted with myself in the morning. I drank too much again. That's it. I'm done. And by the evening, my car goes to the liquor store. So you have got to get into action. Oh, this is another one that I like to use. So the old man's sitting on his porch with his hound dog, and this hound dog is always howling. Just always howling. The neighbor walks by and says, "Oh man, how come your hound dog is always howling?" He says, "Well, he's sitting on a nail." Why is he sitting on a nail? I guess it doesn't hurt bad enough. Sometimes our addictions aren't hurting us bad enough, and so we just stay in them. So I want to tell you a little story. I thought I'd just read a tiny little part of my book to give you a little flavor for it. And I guess the book is available in your library, and we'll try to put another one there. This is a true story. The name is changed. We're calling him Michael. It says here, if you're actively using opioids, even heroin, and having trouble getting free, don't let anyone tell you you've served yourself a death sentence. I've seen even the most down-and-out heroin addicts turn their lives around. I know you're kicking me out, Michael said, tears rolling down his face. The skin around his nostrils was almost as red as his eyes. Michael had been snorting meth and was shooting heroin. I'm just going to die. The last time I saw him, he seemed to be responding well to treatment. Then he disappeared for several months. Today he was wearing a threadbare t-shirt. It was cold outside, and I remember noticing he had no coat. Why did you come back? I gently asked him. Michael was 24 years old, the same age as one of my sons. Like my sons, his arms were covered with tattoos. He had a silver ring in both his eyebrows, a ring in his nose, one in his upper lip. He was in a lot of pain. It's Christmas Eve, I said after a pause. You're here, which means you want to fix this, and you aren't afraid to ask for help. There is no way I'm kicking you out to the street today. We all make mistakes. I know you can do this. I believe in you. We talked about his setback, not being a death sentence. We talked about how failing gives you the space to try again. I wrote him a prescription for buprenorphine for a week. We made a plan for him to avoid his drug dealer, and he made a commitment to come back to his weekly appointments. He didn't have to be ashamed, and he certainly didn't have to disappear. He promised he would try. After 4 months of regular visits, Michael came to the clinic for his appointment, smiling and joking with my office manager, making himself at home. He's been drug-free since. That's a true story, and it was a Christmas Eve. And I get to have those sorts of experiences. They're not always perfect outcomes. This week, I had a young man who said 3 of his friends overdosed this past week. 1 kid, 3 friends overdosing. They put fentanyl in a lot of the heroin, and it's 100 times the strength of morphine. Carfentanil, which is hitting the U.S. streets this past couple years, is 10,000 times the strength of morphine. It's an elephant tranquilizer. A grain of carfentanil in your heroin and you're dead. So these folks don't have a prayer. I see a lot of kids who look just like this. They come in looking like this young lady on the left, and after a few weeks or a month or 2, they get their lives turned around. It is just miraculous. Treatment saves lives. So if you're opioid intoxicated, you got these folks who are just nodding off. They're falling asleep. They're just not there. They can't concentrate. Their pupils are constricted. Their mouth is dry. They might, if it's a really high dose and you're near death, you stop breathing, and some of those other symptoms there. So the overdose, you're going to stop breathing and get cold and clammy, and then your heart finally stops. This is life-saving stuff. If you have a loved one who's struggling with opiates, get some Narcan. You don't even need a prescription in Oregon anymore. You can buy this nasal Narcan, the one that's on the left there. It's a little spray, and you just squirt it in each nostril, and it'll bring them right back if you catch them before they're totally cold and dead. So if you catch the overdose quickly, that's life-saving. So I'm an integrative medicine doctor, and I just put this slide up because I do this in pediatrics, I do it in my addiction clinic, I do this for anybody who will listen. What does it take to be healthy? It takes a balanced immune system. So if you think of a teeter-totter, the immune system needs to be balanced. If you get exposed to a lot of toxins, too many vaccines too soon, you get into an allergy and autoimmune condition. And then if you take immunosuppressants for that, you're on the other side and you're into cancer and infections. So the key to health is something I cover all the time, and it applies basically to any chronic condition. Eat real food, supplement vitamin D, we're all deficient, and stress reduction is key. Good sleep, good exercise, your environment is important. But on that stress thing, we're going to talk about it some more real soon. So I'm asked a lot of times, well, what makes one person an addict and another person not? I truly believe we all have the potential to be addicts of some kind or addicted to some substance or some behavior, but there are certain things that put us at higher risk. Family history. I didn't know I had a family history. My parents were missionaries, and I thought we had the perfect life, and I didn't know of anybody who drank or smoked. My mom since told me I had an uncle. I think we had a lot of workaholics in our family, as I think back, which is, I think I'd pick that one over many of them. If you don't have a nurturing environment, it's another stressor. If you don't have good nutrition, that's going to set you up at the cellular level. Your biome, some of you are familiar, that diversity in our gut, it's very protective for your health, your immunity, and protects you against addictions. Vitamin D it's not actually a vitamin, it's a hormone. We have VDR, vitamin D receptors, in almost all our cells, and it's vital to get that. Toxins. My first book that I wrote on vaccines and healthy kids, the whole chapter is dedicated to toxins, and I touch on it in this book as well. We are living in a world that's full of toxins, from the food we eat, pesticides and herbicides, the water we drink if you're not filtering it, flame retardants on our mattresses, the air we're breathing. The Northwest has the highest benzene in our gasoline of anywhere in the country. It's a big deal. But with addictions, this thing called isolation, feeling alone, having a lack of sense of purpose, it's huge. And if you're not getting enough sleep, you're not getting enough exercise, you're putting yourself in a high-risk situation for addictions. All right. The biggest stressor of all, right here. So when I'm in my office and I'm talking to somebody, if I have my alerts on and we're talking and it goes off, what do? I look at it. Oh, it's my mom. Sorry, Mom. I love my mom, but it's my kid. You're right. But that momentary, we are animal kingdom creatures wired to scan for danger. If you think of how we were basically created, our nervous system is to protect the organism. And so, I'm not being attacked by a bear, but it's a little mini, people who are on social media, right? It's just droop, or video games for the young kids. And in my pediatric practice, I see several teens every day who come in anxious, depressed, can't focus. Some of them can't get out of the house. Some of them are suicidal. And they're spending 7 to 8 hours a day on their phone. And I had a young lady who was 16 years old. I'd known her since she was a baby. She was always happy, an athlete, came from a great family. She came in just suicidal on 2 medications from a psychiatrist. And she was a mess. I went through all my song and dance about the things, food and da-da-da-da. And I said, all right, we're going to lower one dose. You got way too much SSRIs going on here. See you in a month. Contract not to commit suicide. You're going to come in if you're in trouble. She comes in perfectly normal the next month. Just bouncing. I'm like, I actually thought I was in the wrong room. Weren't you here a month ago? Like, yeah, that was me. What? It didn't make sense. Long story short, she had left my office, was playing a soccer game, and had a concussion. Knocked out, went to the ER, MRI, and they said, complete brain rest. You need complete brain rest. No phones, no screens, no TV, no reading, no friends, no school. Rest. And her brain healed. That woke me up to what this thing was doing, because then I asked her, how much time were you spending? And now I ask everybody, because it's a powerful stimulator of neurotransmitters, and you can't handle that much constant stimulation without burning them out. I tell all my addicts in treatment, we learn this in AA, avoid HALT. Hungry, angry, lonely, tired. If you let those things build up on you, you're in risk for relapse. It's a nice way to remember. It's good self-care anyway, right? We don't want to let ourselves get hungry, angry, lonely, and tired. So a few myths about addiction. It's the addict's fault. All right, I chose to drink, but I didn't really realize what I was doing was any different than everybody else, what everybody else was doing. We were drinking, we were in college. It had a different effect on me. Or say you've had multiple surgeries like my wife, and she's given opiates, and then she's given too many opiates, and she's given opiates for too long, and then she's physically dependent, and it's a mess. So I think it's sort of like saying it's your fault you got cancer. It's your fault you got... Addiction is a physical chemical disease, and once it's taken hold of your system, it's not in your control anymore. Successful people don't get addicted. Well, I'm an example of that's not true. All it takes is willpower to stop. Here's the thing. I had willpower for just about anything. I mean, I'm running case conferences. I'm the director of pediatrics at St. Vincent's. I'm this, I'm that, and I can't stop drinking. What's that about? Here's the thing. When you're addicted to something, willpower is gone, right? You take that first drink and the willpower is gone. It's that first drink that gets you. It's the phenomenon of craving kicks in, and you no longer have the choice, the option of choice. The cause of alcoholism is alcohol. The cause of drug addictions of a drug addiction is drugs. Yeah, technically, but the cause is the whole system, right? It's the whole system. It's okay for kids to experiment with drinking and drugs. They're just being kids. I don't know. This one's a little confusing for me. I know in Europe they just give people alcohol with meals and it's all very natural. I don't know. I think I would have liked the effect no matter when I was exposed to it. And certainly you think about the kids I've raised and their early exposure to marijuana, and actually all drugs in Portland are so available. I think the longer you can put it off, we know that developing brains don't do well. The earlier you start drugs, the more likely you are to be addicted. So I disagree with that one. You have to hit rock bottom before you can climb out. This one's tricky, folks. I have a friend who mortgaged her home and then cashed in her retirement account to try to save her son, and he wasn't ready. So he just burned through everything, left that friend who's about my age just destitute. And then again, you'll have stories where somebody's forced into treatment and it saves their lives, right? So you should get someone help if you can, but if they're not ready, it might be worth making sure they're ready first. If an addict doesn't want to be treated, there's nothing you can do. Well, my wife went kicking and screaming, intervention, and she hasn't had any problems since. You can do an intervention. Drinking and drugging is fun and being sober is boring. I used to think that because the media shows all these images of everybody's partying and having a good time, and what are they doing? They're drinking or whatever. I had no idea how much fun you could have sober. You guys are a pretty sober bunch. I'm guessing you know how to have fun. You guys know how to have fun sober, but really you can. You can have just as much fun. That's just kids get, I think all the commercials get us confused. It's all in your genes. You're hardwired to be an addict. The doctor at the treatment center for my wife was asked by one of the patients there, "Doc, are you an alcoholic?" And his response was, I don't know, I've never drank. I thought, wow, if only I had never drank, because I wouldn't have had to go through all the misery I went through. He came from a strong family history. He knew he had risk factors, and he didn't want to push the envelope and try it. So yes, we have risk factors, but it's not hardwiring. It's not like, yes, you're going to be at all. I wanted to tell you about Bruce Alexander, a researcher in Canada in the 80s. He took rats in cages and gave them a choice between water bottles or water with morphine bottles. And these rats would get hooked on the morphine and drink themselves to death sometimes. Then he created a rat park, and he put these rats in this huge area to play where they could mate, have friends, hide, run, whatever they want, wheels to play in. And those same rats would preferentially drink water, not the morphine water. In fact, he could get them addicted to opiates and then move them to the rat park, and they would get rid of their addiction and preferentially choose water. And this speaks to the power of community. That's my community now as far as my kids. They've grown. My youngest is 22. The oldest is 36. And I'm truly blessed to have such a big family. I want to thank you for your attention. I wasn't paying attention to time. Ooh, I went fast. I'm sorry. My mom warned me about this. She said, talk slow, son. So there are neural pathways. I didn't want to not let you understand that in the brain we now know these addiction pathways that exist from the frontal lobe that's supposed to be calming you down and keeping you from being impulsive to pathways that get reinforced by our behaviors. One of the addictionologists that I know real well used to say, my dopamine made me do it, right? So almost all the addictions are propping up dopamine. One of the things I do in integrative medicine for anybody that's got anxiety, depression, addiction, if they're willing, because insurance doesn't cover it, there's a urine neurotransmitter test that will measure things like dopamine, serotonin, norepinephrine, epinephrine, GABA, and glutamate, and a few other things. And you can see where your pathways are out of whack. And then you're not just guessing with your medications. So they've done it in rat studies, and you can see all the various receptors where opiates, cannabinoids, nicotine, GABA, alcohol works on GABA and opioids receptors. They're all over our brain in that midbrain area where we get addicted. So I'm going to take questions. Thank you for your attention.
Doctor?
Yes.
Early in your presentation, you spoke about your work with vaccines.
Yes.
Can you comment on the anti-vax movement and what society can do about it?
You jumped into my favorite topic. My computer screen's a mess. I'm just going to disconnect it. How's that? No? There we go. So in 2004, I had a kid become autistic. I'm a busy pediatrician. Not sure why, but it was after vaccines. In 2005, it happened again. 2006, it happened again. 2007, it happened again. And I'd been learning that there's possibly a link, right? And it's all controversial whether that link really exists. 4 times, shame on me, right? That can't be a coincidence. So I started my new practice, and I created a vaccination system that would cover everything that could harm a child, but delay the things that didn't matter. I'll give you an example. Hepatitis B is something you catch from sex and IV drug use. Babies don't do that. Less than 1% of moms in the U.S. are positive for hepatitis B, and we know who they are. So 99% of babies don't need the hepatitis B, but it's being done routinely. Well, we're going to delay that and do it when you're preteen. And so the vaccine-friendly plan, my first book, was a system of vaccinating slower. Well, now I'm going to fast forward to this week. You asked a question at a very opportune time. The Board of Medical Examiners doesn't like people who don't follow rules. It's my mom's fault for not following rules and throwing me in that village. I wasn't following the rules with with just do the CDC schedule, one size fits all. I was doing an informed consent process and a slower schedule. Well, I was wondering what my outcomes were because I felt like they were very good. So a doctor by the name of Michael Graven, he's set up informatics healthcare systems in 45 countries around the world, Africa, the Middle East. He came into my office 2 weeks ago, spent a week doing a deep dive into the data, and he's just a nerd for the truth. He didn't care what he was going to find, but I had an idea what he would find. I got the report yesterday. I have 3,340 kids born into my practice in the last 10 years. Of those, 715 have not been vaccinated by parents' choice. Those would be what you're calling anti-vaxxers. There was only one autistic kid in the 715. The going rate for autism right now is 1 in 45, according to the Academy of Pediatrics, 1 in 58, according to the CDC, 1 in 715 for the unvaccinated. The remaining 2,240 kids who were selectively vaccinated, sort of along the vaccine-friendly plan that I was saying is a safer way, we had 6 cases for a rate of 1 in 420. So instead of 1 in 45, 1 in 420. That's huge. And as Michael Graven says, this is real-world data. So the problem is we were thinking what the CDC was saying is the right way to do things, and it actually isn't. I like to use the term vaccine risk aware as opposed to anti-vaxxers because we're being put into boxes. So there's Republicans and there's Democrats. Why can't we just be thinking people? There's anti-vaxxers and there's pro-vaxxers. No, let's look at the data. Let's look at the real information. So I'm going to Salem tomorrow to talk to our legislators about the data that I've got because it's critical. It's that balance thing, that balanced immune system is what keeps us healthy. We're over-vaccinating and we're creating autoimmunity, autism. Yes, there is a link. I don't know how many of you saw Full Measure January 6th this year on ABC. Cheryl Atkinson, you can look it up. She did an incredible expose that showed that actually the government's own doctor expert, Andrew Zimmerman, who testified for the government side against the 500 families who were bringing a case of autism being caused by vaccine, he said he went to the DOJ, the Department of Justice, and said there are cases where it occurs. They fired him, and they just used his testimony on the first case. So we don't have all the information, and people are making decisions on inadequate information. Yeah. Yes?
I had a question about the European culture and other cultures that drink or always have drunk with meals and seem to enjoy it. It seems to be part of the culture and the habit, and I wonder why they're not all raging alcoholics. I would like your opinion about having wine and that sort of thing with meals on a regular basis. And the other question I have is, can you differentiate between an addiction and a compulsion? Because those to me seem to be kind of like Siamese twins, since they both aim at anxiety and that sort of thing. But I just wonder what you call the difference between the two. But the first question I think is important.
Yeah.
Because of this taking, wine at meals and beer and that
Right.
sort of thing.
I think the percentage of people who are sort of wired to be at risk for addiction, whether it's 10 or 20%, that percentage of people would probably get in trouble either way. And the other 80% can have their wine with the meal and I'm sure be fine, take it or leave it. I have a son who will order a drink and drink a third of it. That made no sense to me. I mean, I would finish my drink and yours. I'm just wired different. So I know that there are European cultures where that's done and it seems to be okay. And then there's subsets of cultures. You think of the Irish and I think the Russians with their vodka where they're getting in trouble pretty quickly. I don't know. I don't have a perfect answer for that. On the compulsion thing, that's definitely how you're wired, to be more, no frontal lobe inhibitions and you're just compulsive or the anxiety piece. And so you're going to be much more prone to try to calm that down however you can. Self-medication. We know that treating ADD and ADHD, for example, with stimulants, right? You would think, ooh, that's dangerous because they have addictive, potential addictive properties. You have less addiction in treated kids who have ADD and ADHD than those who are untreated. In my clinic, my addiction clinic, almost 50% of them had untreated ADD or ADHD or anxiety. They were always that way. They knew they were that way. And when they found their substance of choice, and sometimes that substance change, they might start with marijuana, try alcohol, end up on opiates or whatever. Yeah.
Thinking about your comment about the vaccinations and such. The difference between a correlation and a causative factor.
Yeah.
And I was interested that you lumped like a vaccination as a vaccination, but there are many things for which we get vaccinated, or for which children get vaccinated.
Right.
So have you looked at, is there, in terms of causative factors, do you see a connection with particular vaccines?
So Dr. Graven just gave me his preliminary analysis, and he can do a deep dive. He did show, and he said it was highly statistically significant, that the number of vaccines correlated with the rate of autism. And so it was causative, but it didn't split them out to which ones. We are aware there's a lot of literature that the two big factors for neurodevelopmental challenges, one is overactivation of the immune system too early. It's called immune activation. If you get rubella or measles or a bad viral illness when you're pregnant, there's a higher risk of autistic kids or neurodevelopmental issues. That's immune activation. If you get vaccines while you're pregnant, you're activating the immune system. That correlation hasn't been played out in the literature, but I suspect it will be shown to be true. The MMR seems to be problematic, but I think here's my theory on that. And no, we haven't got it all spelled out beautifully yet, but I hope to do that with my data because he's got it now. But I think we're injecting all this aluminum, and aluminum has a half-life of 7 years in the body. And then you add the MMR, and it's 3 live viruses, and it's like pouring gas on the fire as far as inflammation in the brain. That's just a hunch as to perhaps why the MMR is problematic. If we just did the MMR like our age group here, actually if you were born before 57, you don't even need a vaccine for measles. We all had measles. So I bet 90% of this room had measles and we were fine. It was just a rite of passage. But for those born after 1957, you probably got a vaccine. It was started in 1963, the measles vaccine here in this country. But it's a good question, and you're right. Correlation doesn't mean causation, but there's something there. There's something there. We just have to tease it out in more detail. Yes.
Another question?
I have a question. What about marijuana? We had a man here who, what's that? Okay,
I got you.
marijuana, and what about even, is there any comparison between being addicted to an iPhone and being addicted to, say, television? Aren't there a whole lot of different kinds?
So if whatever it is you're doing is starting to cause harm, maybe it's progressed. I call it the addiction spectrum in my book because I really believe it's from a benign whatever to now it might be starting to cause some harm to now everybody knows you're in trouble, right? So if we take the screens and the television, for example, most teenagers are fine on their phones for the time being until they're not. So, those neurotransmitters are just going until maybe they're so depleted that you're in trouble. And for marijuana, it's legal now. There are lots of studies that show the earlier you expose the brain to marijuana for teens and young 20s, you can have permanent changes. I mean, they can see it on spectra scans of the brain, just parts of the brain just eaten out. There's something else that I worry about with early marijuana use is it doing anything to things like paranoia, schizophrenia? Because I've hardly ever met a schizophrenic or somebody who's highly paranoid who hasn't done marijuana. That's that cause and effect. I don't know. It's just an association. But it's been known to do that. So that would worry me. And it can happen on your first use or after you've been using it for years. You guys are asking amazing questions.
The question about, one is I was a high school counselor at times, and there was times where I felt more frustrated with pot use than alcohol use, in the sense that I felt like I could talk to the students, the day after they woke up in bed with somebody they didn't know, and yet the pothead would sometimes, I'm so happy. It kind of left over, and I couldn't really feel like I could, discuss much of his problem with them. And I don't know. And the second part also is, since the legalization, does this mean parents are no longer worried about marijuana?
They should be, but I'm worried about the legalization. I think so in my addiction clinic, there are addiction clinics where they used to kick you out if you had a positive urine for any other substance other than, say, the buprenorphine that you're prescribing. I wouldn't have any patients because almost everybody is on marijuana. So I'm going for function, and then I work on them little by little. And I've gotten a percentage, I think it's more like 5 to 10%, to give it up. And almost to a person, when they give up marijuana, the lights come on. I mean, they're just more present. And so sometimes once they're no longer in pain from their addiction and their withdrawal and their life issues that cause them pain, emotional pain, we can start to have that conversation. Well, how do you feel the marijuana's, what's it doing for your motivation? For your ability just to grab hold of life and run with it. And then sometimes they're starting to get well enough that they can actually look at that. And boy, when they let it go, it takes about a month for them to get rid of the just brain fog that develops when you stop it cold turkey or wean off of it. But then they clear up almost always, and they're much more functional. Yeah. Yes.
Do you find that the pendulum that swung with the opiates, where people were losing their doctor's license because they were prescribing too much, is that starting to swing back well, or what's going on?
So what's happened to doctors with opiates? Doctors have lost their license 10, 20 years ago or so for not prescribing enough. So, right, you were leaving people in pain. And I was in that era where we were trained that pain was a vital sign. And OxyContin actually they instigated this. So first they taught us that OxyContin was not addictive, which is total nonsense. And then they taught us that you need to be a good doctor, you need to treat pain. So pain is a vital sign, and the nurses were all taught, and the doctors were all taught. And so you come to me, and I say, well, how's your pain? And, it's a 10, doctor. It's like, oh, well, here's your opiate prescription. And so we started doing so many prescriptions that we were part of the problem for the opioid epidemic. And that's true. We know about 50% of opioid addicts started off with a prescription from their orthodontist, their dentist, or their doctor. Well, now it's swung the other direction. We are so afraid to write pain prescriptions as doctors because people have lost their license. In Oregon, lots of doctors have lost their ability to practice medicine, or they certainly can't do opiates, right? So they banned them from using opiates because they were over-prescribing. So now there's this huge fear, and it's still ongoing today. Most doctors today are very leery of writing opioid prescriptions for legitimate pain. So you'll go in and have major surgery that normally they would give you a month's supply or at least a couple weeks, and they'll give you a week's worth. And you're calling a week later, I'm out, I'm in pain. I had shoulder surgery last July, reattached my supraspinatus, and let me tell you, I mean, they're scraping the bone and then putting screws in there, and I have not had pain like that. It was like, wow. And the thought of doing that without pain meds or not enough pain meds, when you take pain medication, acute pain, so it's legitimate onset, you've had surgery, you've had a major accident, you don't get high. It just relieves the pain. Now, if you're an opioid addict or you're at risk for that, When you no longer need it and you're starting to feel a different feeling and you're liking it, now we're getting into that gray zone, right? So it's so hard for the doctors. They're really, there's still both kinds. There's doctors who are in training centers who will give a lot of pain meds because then they don't get called at night. And then there's the other doctors who are in private practice who don't want to lose their license.
All right, any other question? One more. Okay, I have the microphone.
It just popped into my head right now. It's like, who are we? I mean, how do you see addictions in old people like us? and we're not raising kids anymore either. So, you got any advice or suggestions for older folks who might be on drugs that are addictive? But
I don't think I think, be aware of the various things that are high risk for addiction. So obviously alcohol. If you're drinking every single day and you don't feel right when you don't drink, you're at least alcohol dependent. Opioids, I mean, you guys in old age, I hear there's a lot of aches and pains, right? And so there would probably be a lot of people who are taking opioids. Here's what I can tell you about that. Opioids for chronic pain, it's a slippery slope and it doesn't work very well. So in my addiction clinic, I would say a quarter, maybe a third, but at least a quarter arrive, their issue was chronic pain. And doc, you don't understand. My pain's real. And I've heard that 100 times easy, right? Probably 200 times. And with the exception of a couple people who had like multiple metal rods in their back and just like horrendous surgery history, with the exception of those couple people, every single one of them, their pain got better as I lowered their opiate dose. And you go, what? That doesn't make any sense. The higher the opiates, the better the pain relief. No, if you're in chronic pain and you've flooded those receptors, you've now recruited. If you keep doing high-dose opioids, you recruit more pain receptors. So now you stub your toe and you think you're going to die because you have so many extra pain receptors. When we start slowly weaning you down, and I use buprenorphine for this, those pain receptors downregulate and you actually have less pain. So if opioids is your issue and it's been a long journey with them, you might think about seeing what might happen if you very carefully, very slowly lower the dose and see if you can downregulate pain receptors. Mostly this generation, you guys don't have as much trouble with these, I don't think. So I don't think it's as big of an issue, really. That's a good one. You still remember the dial one, right? Yeah, I used to have pagers and go look for a phone booth when I was first a doctor. It was drug dealers and doctors who had pagers.
One of the questions I have is, what is the genetic research that's going on with gene therapy and so forth? How is it affecting what you see and happen in the area of addiction?
I haven't seen a lot of gene therapy yet in the area of addiction. I think I've read an article or two where they're experimenting with it, but I don't think we're anywhere near prime time for that. I think they're going to have some really great stuff with gene therapy and cancer, because then they can target the specific cancer. And I think that's, personalized medicine is an exciting new frontier. I'm sick and tired of one-size-fits-all medicine. I mean, it's pharma. If I can just get a drug that the masses will use, then we make more money. And, there's so many people who suffer side effects when you do that approach of one size fits all. Yeah, but there's progress coming.
There is a field studying, there's a field studying racial ethnic groups and has defined a term called historical trauma. Mm-hmm. And they link historical trauma to many diseases, including alcoholism. Is that bunk, or is there something to historical trauma?
I I suspect there's something to it because we also know, for example, that grandmother's biome can affect the grandkids. And it's like, what? You know, there's some dysfunction in your biome that sets you up to be at risk, and there's some, So you have to wonder about what happens to the whole psyche of a society, and then of an individual family, and then of an individual, and just our own in America with slavery. And I think we still feel the effects, and Native Americans especially. Yeah.
All right. Are there any more questions? Oh, there are two more. Okay, maybe one there.
A lot of us old people, I'm one of the old people, but I'm not one of the subgroup in this one that I'm going to talk about. But with people in our age group who are in some level of pain, most of us have some levels of pain wherever it is. And there's an increasing tendency for people to go to marijuana in some form. And I don't know if that's a good thing or bad thing for people. So I just wanted you to speak to that.
Sure.
As a they're using it as a painkiller, really.
Right. I've had a little bit of luck with marijuana helping people wean off of opioids. Not a lot, but a little bit. So there have been a few cases where that's clearly helped. CBD is the cannabidiol. I kind of botched that up, but it's the non-psychogenic form that you can get from the hemp plant as well as the marijuana plant. And CBD receptors are, we have a lot of them in our brain, and they help with pain reduction, they help with seizure reduction, and they help with anxiety reduction, as well as boosting the immune system. So I think CBD is great. I totally think you should try that if you're having a problem with pain or immune issues or seizures. The use of marijuana, like I said, I'm mostly worried about the younger age group. So I think if you're in an older age group and it doesn't make you psychotic, right? There's a subset of people who the only time I tried it, I sat in a corner paranoid. I won't touch it. It was like, whoa. My brain and that, I'd probably end up schizophrenic or something. I don't know. It just was weird. So some of us just can't do that, but CBD is totally safe. Yeah.
Okay. As a resident here and as a lay pastoral caller, I'm aware of different levels of pain and some of the causes. Some of us have looked at alternative medicine, especially the research being done by the Arthritis Foundation, the use of the dark cherry juice, and we have some success stories here.
I love alternative medicine. I wasn't aware of dark cherry juice for pain, but now I am. You guys should try it. How could it harm, right? And it's full of antioxidants. I think there's no question massage can help pain. There's no question that acupuncture can help pain. You can do CBD topical. It can be very helpful for pain. And turmeric is a great anti-inflammatory, so you can make your turmeric tea or things like that. There's a lot of natural remedies that are known to make a big difference.
All right. Well, Dr. Paul, thank you very, very much for your talk. That was just wonderful. Really appreciated it.
Thank you for having me.